watching AYV Television.
Good evening, viewers, and welcome to another episode of The Woman's Place, your weekly women's health program, coming to you live on Channel 33 AYV Television. I am your host, Dr. Frances Ramatu Sesay, Obstetrician Gynaecologist. Remember that you can also watch us live on ayvnews.com every Friday at 6 p.m. and that our Facebook page, The Woman's Place, is looking forward to receiving your questions and comments. Tonight, you can also call us on 025-271-959. On this episode, we will be discussing infertility, which is broadly defined as the inability of a couple to have children. The World Health Organization reports that 1 in 7 couples worldwide have difficulty conceiving. The issue of infertility is often neglected in the developing world, where health ministries are mostly trying to reduce booming fertility rates. And women who most often bear the brunt of the burden within our societies mostly suffer from stigmatization and neglect. We hope that by the end of tonight's show, you will consider infertility a serious health condition and therefore refrain from asking that couple who's been married for 5 years without a child, when will you have a child? We truly never know when people are suffering in silence. We sent out a reporter to find out what citizens think about the causes of infertility. Let's have a look.
The challenges that we're in the face in great. We come to the man side. Like man, some man they not can bother for get picking. Woman can like where he get picking. Any side where he pass they go, they want see in picking. One, some of the things that were the cause for the woman no get belly. Low sperm count. Where the man is sperm low, you not able to fertilize the woman. That's not able to make it get belly. 2, infection. If the woman get infection, severe infection, we cannot go able to carry the room. 3, what do they try for say? Number 3, if the blood group no match, that woman not able to get picking. Like example, if the man are positive, then the woman are negative. There is no count the woman go able to give belly. Some of we the woman them, we not can get the problem because of we go through severe tests there at the hospital. But when it comes to the man, the moment the woman tell the man say, "Can I go hospital? I go do some tests them," the man not they do one. The man where they wear tight boxer, that's all they kill the sperm inside the womb.
At times, the problem can come to man. So man, he gets weaker sperm. The sperm cell, it operates. It up the man, woman, but in order to operate, the wife operate because we get some man in the sperm is full of dead cells. We get about 450 something sperm cells we're capable of pregnating a lady. But those sperm cells are not capable enough to pregnate a man. You're not going to pregnate her. So that can cause down one factor, and another factor can seemingly come off from woman. So woman they not use for taking these pills, this protection against for pregnancy. Some protection prevention the way they take for they not get belly. It make the womb they starve.
Barrenness. I don't say that the man, you know, because there are times God makes certain people, God not make all man for born picking. So people they go the car, they naturally so and can so they go. But men also don't barrenness, mostly not to the woman there. Yes, because every man they try to forget picking, but woman they back need boku prevention. The injection, captain ban, they say now they go and borrow, you go pull them. But no day, they don't reach menopause. You know, so woman 40 years old, I go say, and then they born again. So woman they 50 they born. But that boku prevention back, it can cause all the things in there.
It can might be say the man and the woman the blood no match. So woman and kinde sometimes I want to pick go again and belly might be on go pull belly. So it can possibly say we married, it can take a while. For like get belly if not easy. That's not new idea. Yes, it can be so back. and the man not can get the same blood. So man back in you and not strong. Sometimes you have to get for a long time, they cannot the other way, they can't energy not again. Now just embarrassment, not human. Now you can get because some man they decided a man in the parts because some man they embarrass even to the man in family self. Some they costume and say barrel. Well sometimes to the woman make if you say the problem. Some back it can be seen at the woman because of well belena one.
Okay, so viewers, you've just watched a video in which the citizens of Sierra Leone, or Freetown I should say, were expressing their opinions as to what possible causes of infertility are. We are going to talk about that a bit later, but with me this evening I have Dr. Amadu Sesay, Obstetrician Gynaecologist, working at the Princess Christian Maternity Hospital. Please say good evening, Dr. Sesay.
Good evening, viewers.
Thank you. So we're going to talk about the video a bit later, but let's start from the beginning. I mentioned earlier like a broad definition of infertility. I just said inability to have children, but break it down for us. Tell us what the definition is for infertility.
Yes, infertility actually is the inability of a couple to conceive after being together, having regular coitus for a period of 1 year. And then they are unable to conceive, then we say they are infertile. Generally, we look at couples that are a bit older, we give a slightly lower duration of time, so about 6 months or so. But generally, it's 1 year without conception, regular coitus, and unprotected, no contraception used.
So you just, first of all, you just use the word coitus. Explain what that means before we go to what regular coitus means.
That actually means sexual intercourse between a man and a woman.
Yes, and then you said regular, because I mean, we know that we have patients, we see patients sometimes and they say, well, my husband works in the provinces and I'm here in Freetown and we're trying to have a child. How would that work? What is regular intercourse? What are we talking about?
We expect, say 2 to 3 times a week. But generally, there is no universally accepted duration or frequency of having sexual intercourse. But we think with 2 to 3 times, in fact, it has been documented that 4 times or more a week have higher pregnancy rates, generally.
Okay, thank you for that clarification. When would you say you have peaks for fertility? Like which age group would you think you have peaks for fertility, and when would you say fertility begins to decline? In a woman, I mean, we're talking about it.
Women in their 20s, early 20s are the most fertile. Say by the mid-20s, 24, 25, there is the peak of their fertility. And thereafter, towards the end of the 20s and the entry of 30s, fertility starts to decline. And it declines progressively over time after 30 years. By the time they get to about 40, fertility is much lower, for women. The same is generally true for men, but men it's slightly lesser. Right. Men actually cope with, can actually conceive even at a later age.
Exactly, you have old elderly women, so you have elderly men having children.
Yes, so you have elderly men. But again, you have to note that with age, the quality of the sperm cells decline. The motility also decline, and this is also true for men. So even elderly men have their fertility or conception potential decrease over time. That happens.
Okay, so now we're talking a lot about, fertility. I mean, we know in general, I know most people who did biology, we're talking about how a man and a woman gets together and make a baby in general, right? But we're going to play a video which is going to show basically what happens within the woman's body, how the sperm gets into the woman's body, and how a baby is conceived. So we're going to go through that video, and as the video is playing, Dr. Sesay is going to be giving us a step-by-step. This is basically just for general understanding, so we know what happens. So when we come to talk about what are the possible causes for infertility, for example, you would know exactly which part of the reproductive system we're talking about. So let's go to that video right now. Go ahead.
Yes, what we have on the video, as we can see, this is the female reproductive organs. We can see the womb, we can see the entry to the womb, we can see the vagina, and then the two round structures on both sides are where we have the eggs being produced. Now, if you take a close look, this is one of the areas that produces eggs, which we call the ovaries. And every month, there is an egg that is being produced, the brown color that you see there, the round structure like a moon, that is the egg that is produced. And it moves into a tubal structure. As you can see, there are finger-like projections into which that egg moves. Now, as it is moving, you can see that there are ciliary structures that actually help push it, towards the womb. Now, it moves in the direction of the womb. The womb is what you see at the center, the big red cavity there. Now, look, as you can see, there are small ascending structures. The little ones you are seeing swimming upwards, those are the sperm cells. And where are they going to? They are heading for the egg that is situated within the tube. Now, as they approach the egg around the tube, okay, now we see that they are now close to the egg. As you see them advancing, now they come around the tube, they are attracted. Now, what happens? One of them tries to get entry into the egg.
So not everyone wins.
Not everyone wins, yes. One enters. Millions of them swim. A lot of them do not make the journey to that point. Exactly. But then when they arrive, one enters. And the one that is successful to enter actually is the one that carries with it its genes. Now, that causes fertilization. Now, this is a fertilized egg now, as you're seeing.
Fertilization is when the egg and the sperm meet
exactly,
in the tube.
In the tube. Now, see what is happening to the egg that is fertilized. It is breaking down, it is forming new cells. It is dividing into multiple cells. And as this division process continues within this tube, now that division process continues, then the egg continues to move, which is now fertilized egg, having this sperm material inside it, and it moves and forms a ball. This ball structure is actually what comes into the womb. It is now inside the womb, inside that cavity. Now it is finding a right spot to attach,
to implant. Right.
And when it attaches to that right spot, it will implant and start growing in the womb. As you can see, it's burying. It buries into the womb surface inside, and then it's like, just like you have a seed growing or germinating. Exactly. That is the exact thing that happens. Exactly. And then it forms multiple layers. These are what some of the structures of the egg now. It forms multiple cells, multiplication of cells take place, and then it continues to grow, mind you. It continues to
and this is a process that takes over days and weeks as you're going.
Yes.
So it's not immediate.
It's about 5 days, and then it grows to form a fetus. This is the baby that we are seeing.
Exactly.
So, by and large, that is what happens.
Very good. So we hope you've been able to understand, because as we get to discuss further about infertility, we want to know, first of all, how a baby is made. And so that video, I hope you, the audience out there has been able to understand the processes, at least the basic processes that occur when it comes to fertilization. So what are the types of infertility?
Infertility, generally, we classify them into primary infertility and secondary infertility. Basically, what that means is primary infertility is a couple being together for that duration of time, which I just talked about, a year, having regular intercourse, sexual intercourse, and not conceiving. But if the woman or the couple have had a child before, then if they are now seeking for a second child and there is some challenge actually in getting a second child, we refer to that as secondary infertility. It basically means this couple has had a baby before, or this woman has had a baby before.
Or the man.
Or the man. Yeah. and now he's trying to get, that is secondary. Yes. Primary, they have never had a baby before. That is just about whether or not they have had a child before.
Right. And then also when we talk about fertility now, we're talking about, we can also talk about the different, genders. There's male infertility and there's female infertility. I know in this part of the world, mostly when we talk about infertility, it's the woman, it's her fault. It's a reason, it's a fault with her, but there's also that. And let's discuss what are the current percentages when it comes to the different genders, as to what percentage approximately males contribute to infertility and also females.
Generally, they are roughly equal contributions, roughly 40-40.
Repeat that. Yeah, that's very important, a very important message to be said.
Generally, about 40% of the time, it's the male, and about another 40% of the time, it's the female that has a problem. And we have about say 10% of the time, of 10 to 15% when both of them have the problem, and about 5% when we cannot explain. Having done all investigations, we cannot explain what the cause is.
Yes,
but they contribute almost equal to the problem. But that is actually not what presents to us generally, or what happens.
Exactly.
Men generally think the problem of infertility is a woman's problem.
Exactly.
But then it has been shown that men actually contribute about 40%, almost equal to what women contribute.
Exactly, that's true. So we've just watched that video where citizens of Freetown, you know, some people were voicing out their opinions as to what are the possible causes of infertility, and I was actually very happy. There were some truths to it. I mean, some not so, you know, truths, but there was some truth to it. So let's discuss this, because I think this is the brunt of the issue, right? When we talk about why this couple or this woman or this man is not capable of having children, let's start with the females. Let's start with the females. Let's kind of go, you know, step by step as to what the possible causes can be.
Okay. From the video we just saw, I mean, this is very clear. What we saw sperm cells swimming towards the womb, swimming through the tubes, moving towards the direction to meet the egg that has been released from the ovaries. Generally, for fertility to occur, an egg has to be produced by the woman. That is what we refer to as ovulation. Then also there has to be sperms that are actually motile, they can swim. Sperms that are actually functional, that means they have the capacity to be able to go through the wall or the shell of this egg and then fertilize it. And then also the tubes have to be patent, have to be open, and have to be also nourishing to this fertilized egg that will be coming to implant into the womb. And also the fertilized egg needs to have the ability to implant. So all of these factors have to be present for a successful pregnancy to occur. So we have, if at any point along the line there is a problem, say for instance the woman does not produce egg, which is
like ovulation
problem, or of course pregnancy will not occur. If there are no functional sperms that are actually of good quality and capable of course fertilizing an egg, then there will be problems. If the passage towards the womb is blocked for some reason or the other, there will be problems. If the passage through the tubes where the eggs have to pass through is blocked or has some problems, then there will be a problem with conception. If even the passages are fine, but then the bed, that is the womb, the surface, is not ideal for implantation, then there will be a problem. Or even if it's ideal for implantation, yet still the hormones or the substances and the nourishing materials that should be provided for this young fetus or this young baby to grow are not there, then the pregnancy will also fail. So you see, multiple steps and levels and phases are actually contributory to have a live baby.
Okay, you've given us a general, yes, but let's just take it, you know, like individually. Let's say ovulatory dysfunction. Now we're talking about, we've shown the picture of that, the ovaries that release one egg every month. So a woman might be having her menses, but not necessarily ovulating. So in general, we talk about, when we talk about ovulatory disorders, like what possible conditions, because there are also other conditions that can inhibits that woman from ovulating.
Yes, actually there are quite a number of conditions that can actually affect a woman and prevent her from ovulating, which means she does not produce eggs.
Right.
We have different levels of the human body. From the brain, there are central control mechanisms at the level of the brain. For a woman who does not have sufficient good diet, we have women, for instance, because of some reason do not eat well, which we refer to as anorexia. They starve themselves and they do not have sufficient fats in their body to produce sufficient hormones. They will not ovulate. Women who are into athleticism, running or exercising a lot, it affects the brain center that controls these hormonal messages that are responsible for the production of eggs. Then also, even at the level, women that have extreme stress, if you have a you are in extreme stress, it would affect your menstruation and also affect sometimes your ovulation.
Just to reiterate, that's a very important point, because we both know, we've seen patients that come in, I've missed my period for a month or two, you do a pregnancy test, it's negative, then you start talking to them and asking them, so what's happening in your life? Like, what's any changes or anything? And they start giving you this entire rundown.
Heavy, stressful marital issues and all that. So stress is a factor. In fact, one of the treatments modalities is actually mechanisms to reduce or minimize stress. That actually affects this hormonal flow and balance within the body and prevent ovulation or egg production from taking place. And also, even at the level of the brain, we have some organs there. One of them is the pituitary gland. Sometimes there are tumors in that gland, and those tumors, cancers or growths in the brain also can affect actually the hormonal balance. And also sometimes the way the ovaries respond, the way these organs also respond to the hormone, there can be some faults and problems in that. There are conditions like we call, say, polycystic ovarian syndrome, which actually affect women, extreme obesity, excessive weight gain or weight loss. Those are all factors that can actually affect a woman's ovulation or egg production. So
now we've talked about, in general, ovulatory disorders, but now let's come to the womb itself, the uterus, right? Because there can be conditions in which we've seen the video where we talk about implantation, for example, where implantation would not be possible if certain conditions exist. So let's talk about that one.
Yes. Now, there are a lot of conditions actually that things that can go wrong with the womb. For instance, some women are actually born naturally with a womb that is actually not well formed when they were babies also in their mother's womb. So the natural development of the womb sometimes can have some defects, which we refer to as congenital malformations of the womb itself. Sometimes there are septum, which are like barriers in the womb. Sometimes the cavity of the womb is distorted. Sometimes even the womb itself, there are scars inside the womb. A condition we refer to as uterine adhesions, intrauterine adhesions. Sometimes there are fibroids which are inside the womb and then pressing on the cavity, the uterine cavity. That is the womb.
Yeah, but also when you're talking about fibroids, that's a very important point. I mean, we're talking about the womb, but also it can block the tubes, which is necessary when we talk about fertilization, having the sperm move up to the tubes.
Yes, the tubes. If those tubes are blocked, if those tubes are kinked, if those tubes are not in good alignment with where the eggs come from, which we refer to as tubo-ovarian relationship, then that also affects the eggs that are produced do not go through the tubes. They would go somewhere else and produce a pregnancy in a wrong location, which is also another bad thing.
Now, I want to dwell a bit on these tubal factors, because in a country like ours where we have huge STI indices and mostly people go undiagnosed, they go untreated or inadequately treated, I should say, or women come in sometimes and they come and you give them medication, their partners are not seen or treated, so you have these prolonged and chronic pelvic inflammatory diseases, and obviously that leads to infertility, as we're talking about. Kindly just dwell a bit on that.
Yes, that again is a very key issue. In fact, in our part of the world, one of the key factors that contribute to infertility in women is actually infections of the pelvis and then the pelvic organ or the genital organs. And you mentioned STIs, sexually transmitted infections. You know, like gonorrhea and other infections that actually affect the womb and cause scarring. Sometimes the tubes get scars within the canal, the lining, and that blocks the tube. Sometimes the tubes get adhesions that actually kink or change the structure or the shape of the tubes. Sometimes also these infections cause inflammatory or changes that actually within the pelvis, sometimes with pain and other factors that make the fluids or these nutrients that these embryos should actually feed on when they are moving through the tubes are not there. So the fluid actually that is produced in those tubes becomes toxic to these young fetus that is just been fertilized. So those factors actually, but generally infections, and the infections actually come from multiple sources. One, of course, multiple sexual partners, unprotected intercourse, as well as even during childbirth. If the process of childbirth is not strictly hygienic or carefully conducted, a woman might go down just after delivering a baby with fever and infection, and those infections, mind you, have the potential to affect the tubes.
So, I mean, that was a very good point to highlight, because I think most of the patients that we see and we ask when we're taking a history, we ask about history of previous, well, we usually say you can get discharged and all the rest of it. You can smell bad and all the rest of it. they don't realize how having a condition like that over several months, over several years, can have, you know, long-term effects with their reproductive life. So that's a very important thing, and I was happy. I mean, speaking of that, let's think about that video that we just went through. Somebody mentioned something like that.
Somebody
so it's
mentioned,
a very good thing.
Exactly. Somebody mentioned infections in women and the like. You know, another thing is abortions. Abortions can sometimes complicate and cause problems with tubes. Abortion is actually a failure of a pregnancy, usually at an early stage. And sometimes it can occur spontaneously on its own. Yes, and sometimes it occurs as a result of the, you know, volition of the woman. The woman herself goes and tries to terminate the pregnancy. If that is not done safely, and also if that is not managed well, and then infection sets in, that has a tendency of actually blocking the tube. The other thing that I need to mention is actually people like to do D&C, which is actually, they call it cleaning. Now, that is,
get pregnant.
Yes, to get pregnant, which is very wrong. That is not correct practice. In fact, in some instances, the instrument that are being used to do the so-called cleaning are actually sharp instruments which are sometimes not sterile, and they cause trauma to these very delicate tissues of the tubes, the uterus, the womb. And then when you traumatize the womb and then the tubes, that can cause scarring and cause problems. So people should generally avoid routine D&C. Don't just do a D&C like that, or
There's
go
no
for
such
D&C. There's no such thing like cleaning.
fertility.
Yes, for fertility.
Definitely not. No,
so that is something that is
fertility.
also dangerous and affects tubal, patency.
Thank you very much, Dr. Sesay. That's good. We've talked about female causes. Now, again, like we've said over and over, in this part of the world, a woman is the first person that we think about. But obviously, there are male causes. I've seen several patients in which, you know, you'll be seeing this person. Ideally, you would tell the patient when you first see her, you should come with your husband. Like, oh no, he's fine. He says everything is okay with him. So then, obviously, when you do all of your tests for the female, you find out that everything is okay. Then you ask the man to eventually come in, and you find out that he has issues. So let's talk about male causes of infertility. Yes,
our males don't come to the clinic. You know, in fact, rarely do they accompany their partners to come to the clinic for counseling and for, you know, fertility services. And yet still we know, of course, based on the statistics we have just given, that male actually make a significant contribution to the causes of infertility. Now, the fact that a man can get an erection and get a normal sexual intercourse does not mean that there is no problem or they are actually fertile. Absolutely.
Good point.
So many things can actually be wrong. Sometimes you can get an erection, yes, and then you get an intercourse, but then some men do not get orgasm, which is actually climax, and then that's the time that you know, production of or discharge of the semen or sperm occurs. Sometimes, even upon discharge of the sperm, it does not go forward. We refer to it as retrograde ejaculation, which causes it goes back. So instead of the sperm actually going forward, it goes back. But you would have your normal intercourse, and you think you are satisfied.
Yes.
But then what you have discharged has not actually gone into the woman, and it's
has no sperm.
Or has no sperm cell. Sometimes, in fact, yes, what goes in is just fluid without sperm cells that are actually functional and viable. Sometimes they would have sperm cells, but the sperm cells are not alive, or they cannot swim sufficiently enough. Or sometimes they, even if they swim, they are not swimming forward, progressing forward. They swim in multiple directions haphazardly, and they cannot go forward like we saw in the video, forward direction, you know, of swim. And also even the shape and form, sometimes morphologically some of the sperm cells are abnormal. It's only when you come to the clinic and then we get some of these tested for, then you would know. And also, a lot of times in our setting, men have subclinical infections. That is, infections that are there on the accessory male glands and also do not cause symptoms. You do not feel pain, so you don't feel burning sensation. You think, I'm fine. But I don't feel any pain, I don't have any symptoms, so I'm fine. But then sometimes there are infections. We refer to those as male accessory glands infections. And those are a major cause. In fact, the prostate gland can sometimes get them, and the seminal vesicles, and you know, other glands that actually accompany to produce these, you know, sperm.
Very good point. I'm happy you talked about the fact that most men do not come to the hospital, and I want to say probably no fault of theirs, because they don't have symptoms. And I think that's the message we need to get across. If your the females present with symptoms. So if your partner is having certain symptoms, you also need to accompany her to the clinic. You also need to get tested. That's very important because obviously it affects your reproductive life. Some of the same things we've talked about when it comes to causes with regards to female infertility also apply to men, like obesity. Excessive exercise, yes, and also stress. So that's like a baseline. But also there are some infections. We're talking about sexually transmitted infections, but there are other things like mumps, for example.
Yes.
Like if a man or a boy had mumps in childhood, there's a high chance of that boy being infertile in adulthood. So that's also something that we have to remember, hence the importance of the vaccine. Yes. We also want to talk about heat. Talk about heat a bit and its effect on sperm production.
In fact, it was known in times before that, you know, men that used to work in steam combustion engines, where they would be, you know, shoveling coals and heaps of coal, which is a very heated room. That high temperature actually is disadvantageous to sperm production and then sperm survival. Generally, the testis actually is an organ that is outside the body because nature wants it to be cool, at a slightly lower temperature than the core body, inner body temperature. Yeah. So that is why it's outside. So if you wear tight pants, if you wear multiple pants and you keep it too warm, in fact, people are saying, in fact, long distance drivers who sit on engines that are actually just underneath their seats while they are driving for long hours have the tendency to actually cause more heat around the genital area. So you should wear actually underpants that are actually a bit light, you know, can allow aeration, air, and then also you should not wear multiple layers of covering, you know, on the genital area for men. You know, so excessive heat production is one thing that actually affects sperm quality and affects sperm production. And let me just mention one other thing. You know, men also that have actually undergone surgical procedures, like say herniorrhaphy or even other pelvic surgeries, repair of hernias, or even hydrocele, which those surgeries actually on the genital area sometimes can have complications or adhesions that affect the veins that drain blood from the testes or the lower genital or scrotal region, and also can also affect even the tube that conducts the sperms from the testes, which we call the vas. Yes. You know, sometimes it can be injured in those surgical procedures.
So you see that the causes are so many. So that's why when we see a couple who is infertile, we don't just say, well, it's this person's fault or this person's fault. So several investigations need to be done for you to be able to determine where the cause is and see if it's possible to be rectified. Okay, viewers, remember you're watching The Woman's Place, coming to you live on Channel 33, AYV Television. You can also watch us online at ayvnews.com. Remember to visit our Facebook page at The Woman's Place and leave your comments and your suggestions or your questions. You can call us on 025-271-959, 025-271-959. We are going to take a short break. We're here with Dr. Amadu Sesay, and we're talking about infertility, male and female infertility. We'll be right back after this message to continue the conversation. Welcome back, viewers. This is the Woman's Place show, live on channel 33 AYV television. We are discussing infertility today. I have with me Dr. Amadu Sesay, obstetrician gynecologist working at the PCMH, Princess Christian Maternity Hospital. We've been discussing male and female factors with regards to causes of infertility. We're going to go, the phone lines are open, by the way. You can call us on 025-271-959, 025-271-959. You can also check us out on our Facebook page at the Woman's Place on Facebook, and we'll be here to receive your comments and your questions. We are going to get right back into the conversation. We're going to talk about the risk factors when it comes to infertility. I mean, we mentioned here and there, but let's talk about them specifically, risk factors for infertility.
Yeah. Yes, actually, risk factors, there are quite a number of risk factors. As I said, in our setting, the major one is actually infection rate.
Okay, so wait, I'm going to stop you just for a second. We have a caller. You're on the line. What's your name and where are you calling from?
Hello, good evening.
Can you hear me? Okay, we're going to continue. I think we missed that call. We're talking about risk factors for infertility.
Yes, so as I said, the major cause in our setting is actually infection related and tubal factor infertility. Because just as I started, we have so many other factors that actually contribute to infertility, but the tubal factor is the most predominant within our setting. And those factors that actually predispose one to STIs and infections and tubal blockage. Okay,
let's take this caller. Sorry, Dr. Sesay. Let's take this caller. What's your name and where are you calling from? Welcome to the Woman's Place. Hello, can you hear us? Okay, I think we seem to be having some technical difficulties. We're just going to go right back into it. You were talking about infections. But age, for example, when it comes to women, what do you think about age as a risk factor for infertility?
Yes, of course, fertility declines with advancing age. As age progresses, fertility declines. About 30 years, fertility and above, fertility begins to decline. And then by, say, late 30s, it's low. And then, even though you would have, of course, some women getting pregnant even close to 50, I mean, extremes, but then generally, as you go outside your 20s, fertility declines. That is one key factor or contributing.
Okay, thank you. Yes, caller?
Hello?
Yes, hello.
Yeah.
Welcome to the Woman's Place.
Yeah.
What's your name and where are you calling from?
I'm calling from Mountain.
Okay, your name, please?
Geneva.
Okay, Geneva. Waiting are you question?
Well, the question I ask, like, if it's possible for fasting, like, where you mess time, the period time can pass, if it's possible for like bone.
Do you beg to come back?
Like, really, you can mess 6 months until another month to jump. So, like, it's impossible for like the fasting can done.
I don't think so. We kindly repeat your question.
The question I ask?
Yes, please.
I said?
Yes.
Like, if the person months the pattern period in circle, like it's impossible for let the person go born.
Okay, so you're asking if you've missed your period for a couple of months and if it's possible for you to conceive. Okay, just hold on. Dr. Sesay is going to take that question.
For a woman of reproductive age, who can consider us within the ages of 15 to 52, before menopause, if the period passes you, the first thing we will do is do a pregnancy test. Would you ask? Yes. The first thing that we do actually is to do a pregnancy test. Yes.
No, just hold on. Dr. Sesay, answer this question. Yes.
Yes. I think your question is hello. Yes. I think your question is whether or not it's possible to conceive if you are having irregular or missed periods.
Right.
First of all, if you haven't missed periods, it's likely that you are not ovulating. But again, missed periods in a woman of reproductive age would actually warrant us to check for the possibility of pregnancy.
Right.
We check or rule that out first. Then we get further history to know exactly what is causing the missed period. But what that indicates generally is a woman who is not having a period regularly, that is within a 28-day cycle, is highly likely not ovulating, not producing eggs.
Okay.
And then if it's, a woman is not producing eggs, that woman will not conceive. So if you are having problems with regular menstruation, the first thing you should think is see your doctor and get it checked out. Because the tendency for you to conceive when you're not having regular periods and not having monthly eggs,
thank you,
is high for you not to conceive.
Okay, let's take another call. Yes, caller. Who are you calling from? What's your name? Hello?
Hello.
Yes. What's your name and where are you calling from?
Yes. Meaning from London. Yes.
I can barely hear you. Speak up, please.
I call from London.
Okay, go ahead. Yes, go ahead. Go ahead.
At the time for control, you activity tell. What say if activity tell go begin when after with you period?
Okay. We'll get to that. So let's take another call. Thank you very much from Lumley. We'll see if Dr. Sesay will be able to answer that question. Okay, so we were just, okay, go ahead. Another call.
Yes. Hello?
Yes.
Yeah, this is Fatma from Lumley again.
Fatma from Lumley, yes.
These are in connection to fibroids.
Fibroids, yes.
Yes. If you don't do a fibroid operation like 110, 210,
yes, then
you notice you get again.
Okay.
If they do all you go able to born again, or if they can put all the womb and everything, it will be okay for the third time.
Okay.
It's safe.
All right, thank you. So the first question was about when is your fertile period after your menses, and the second question is if you've had repeated surgeries for fibroids, if you'll be able to conceive. Let's see if we can get another call, and Dr. Sesay will come in and answer those questions for us.
Okay.
But maybe you start as we wait for another call.
Yes.
Yeah, so hold on. I think we're going to get another call. Yes. Yes. Welcome to the Woman's Place. What's your name and where are you calling from?
Good evening.
Good evening.
Conte.
Yes, Mr. Conte. Okay, welcome. What's your question?
The question is?
Yes.
I want to custom for president. I want to know if that is positive.
Mr. Conte, I'm going to ask you to speak up a bit. I can't hear you.
Okay, I'll call it.
Okay, maybe we'll call again. We'll just take one more call and then Dr. Sesay can answer the question. So just one more call and then Dr. Sesay can answer the question. So like I said, the first one, she wanted to know when the fertile period was. Yes, please, another call. Where are you calling from, caller? Welcome to the Woman's Place.
Good evening, I call from Aberdeen.
Aberdeen, welcome.
Yes, my name is Sarah.
Sarah,
I want to ask one question. If woman gets one tube, is it possible for me to be born?
That's very good. Thank you. So she wants to know if you only have one fallopian tube, if you can conceive. So I think we're going to have Dr. Sesay come in and answer those questions. Let's just close the phone lines for now. So the first one, when's your fertile period?
Generally, for a woman that menstruates regularly, within 28 days or have 28-day cycle, it is the 14th day. That is the mid-cycle. That is when we think you are ovulating or producing an egg. And close to that day is when we think you are fertile. So in other words, take about 3-4 days after that day, about 3-4 days before that day, the 14th day. That is when we think you are most fertile. And in fact, it's within a week. So every month, a woman has chances of conceiving within a space of about a week.
So it's very important, I think, that we mentioned that women have varying cycles. So it does not, everybody does not have a 28-day cycle. Right.
Yes. But generally, if assuming the cycle is regular and it's a 28-day cycle, it's the 14th day. If the cycle is irregular, then it becomes a different time. It becomes difficult to predict when exactly ovulation is occurring. In fact, If it is irregular in most cases or some cases, there is no ovulation, no egg production at all.
Right.
So that is the thing. If a regular cycle, then the 14th day. That is the first day you start menstruation.
That's
that
your
first day is your first day.
Yeah.
You count 14 days down the line. On that 14th day is when ovulation is likely to occur.
And that's a very important point, because I've had women that come in and say, well, I had my period on the 5th this month. I'm supposed to have my period again on the 5th. So it's very good that we educate them when it comes to cycles, that you can go from as little as 21 to up to 35. And you just have to know what your cycle is to be able to figure out when your ovulation day is with regards to you and your OBGYN. So it's very important that you keep a note.
A note, yes.
You know, because they usually forget, right? I know everybody has this Flow app now, but it's very important that you write it down. So we know. But the second question was, if you've had repeated fibroid surgeries, myomectomies, if you can conceive.
Yes, that's a very good question. Actually, fibroids sometimes occur multiple. That is, you have more than one. Now, the first surgery, it is assumed that they get everything out. Even when you get all of the fibroid lesions out in the first surgery, sometimes you can have new ones sprouting again. And then you would have to do a second surgery again. But then it's not good to keep doing surgeries every now and then. It is best when you have the first surgeon operating for fibroid, getting as much as possible of the lesions of the fibroids out.
Don't have to go
so that
back
you don't have to go back again. But then if it's well done, sometimes that helps. Again, fertility is not just fibroid dependent.
Exactly.
There might be other causes that are underlying that actually affect.
So it doesn't mean when you take out the fibroid, you will get pregnant.
You have to get pregnant. And also, it's not all fibroids that actually need operation. There are some fibroids that women can have that do not require surgery.
Exactly.
And would not affect, in fact, their fertility.
Exactly.
They are capable of conceiving. So it's good to get to consult a doctor, consult your gynecologist, and then get to know which fibroid. Is my fibroid operable? Should it be operated upon or not?
Exactly.
Or what the recommendations
would it affect my fertility?
Would it affect my fertility or not?
Exactly.
So
thank you very much, Dr. Sesay. So unfortunately, I think we've only been able to take in 2 calls, and I think Dr. Sesay has been able to answer those questions. So we're just going to come back to, we're talking about risk factors. We've mentioned age. Yes. With regards to reduced follicles. I mean, it's also important to mention that women are born with a certain number of eggs. You don't make new ones. So what you have is what you have. So the older you are, the less eggs you have, the more they are. Yes, continue from that.
Yes. When a woman, a girl baby, is inside her mother's womb, she has about 7 million eggs. By the time she's been born at birth, that is about 20 weeks, 5 months pregnant, little baby girl inside her mom's tummy. Now that little baby girl growing to get into term, by the time she's delivered to a little baby girl, she has just about 2 million. 5 million have cells or eggs have died out. That 2 million, by the time she gets to puberty, she has about 400,000. From that 2 million, we have 1,600,000 have died away. That 400,000 is from that pool that she will be ovulating one every month.
Exactly.
And every month she ovulates, the remaining will die anyway, whether or not she ovulates. As time goes on, a lot of them die. So you see that so many eggs are being produced from inside the womb while this woman is a baby girl inside her mom's tummy, to the point she gets to be delivered, and to the point she grows up to be an adult woman. Exactly. You know, and then gets to ovulate. That 400,000 is what she will get one every month, and then even if she does not ovulate, they will still reduce.
So that's a major difference between males and females, because males are still produce sperm all the way up to old age. So that's maybe why one of the concerns is mostly on females. But for sure, that has to be discussed. But other things that we have to talk about: alcohol use, cigarette smoking, and the environment, pesticides, and
pollutants.
Exactly. And obviously we've mentioned obesity and sexually transmitted infections. So those are all risk factors. If people, are older, have any of these conditions, they most likely would be considered, eventually will face infertility. Hence the reason why we talk a lot about lifestyle changes when, patients come in. Yes, you wanted to say something?
Yes, this just actually brought to my mind something.
Yeah.
Generally, people who work with computers, especially laptops, the radiation emitted from these gadgets. It is recommended that you do not have them close to your laps for long hours with the heat connected to batteries. And of course, the radiation they emit is even more when the batteries are dying down. And even with phones, mobile phones in your pockets, I mean, people are thinking now that possibly when the charges are going down and you get calls, especially for men,
it's like more radiation.
You will be exposed to radiation. And also there are also other things like drugs and medicines that people take, you know, that affect both, you know, performance or sexual function as well as, you know, the quality of
the sperm. So Dr. Sesay, quickly, we are about to close off, but let's just talk about maybe a minute. When patients come in, or couples, I'm not saying women, but couples come into the clinic for consult for infertility, what kind of questions do we usually ask them? Like, what should they be prepared to answer? Because there are certain things that are like, I don't want to talk about this, but what should they be prepared to answer when they come in?
One thing I generally ask about is, which sometimes is an issue. As I mentioned, it's just a 7 days window. And that egg that is being produced within 36 hours should come in contact with a sperm cell. If not, that egg will die out and then you wait for the next month. So it's a narrow window. So one thing I actually ask them is the frequency of coitus, consummation of marriage.
Of sexual
Sometimes
intercourse.
we are so busy with our work, we are so busy with so many things that we do not have time for intimacy with our partners and then intercourse, and then because that is one key thing.
Exactly.
Whether or not they are actually having regular
we've discussed
intercourse
before.
as we have discussed before.
Right.
And also whether there are problems with from the male standpoint, erection, maintenance of erection, whether they are not getting orgasm, ejaculation, you know, down to testicular problems or other things. Then also for the woman, one of the things that is very important is whether or not she's having regular cycles. Whether or not,
her menses are regular.
Yes, when the menses are regular, it's a fair enough indicator that she is likely ovulating or producing eggs.
Okay, that's true. And we'll talk about, obviously, we'll ask them usually about, do you have any symptoms before you have your menses, which is also an indication of ovulation. Past surgeries we've discussed already, and any disease conditions, because there are also medical conditions that, like if you have thyroid disorders, if you have diabetes, all of those things, that can affect your fertility. So it's important that we do that. We mentioned before that 1 in 7 couples are affected worldwide when it comes to infertility, but actually in the developing world, it's 1 in 4. So it's actually higher for us than elsewhere. But obviously, countries like us pay less attention when it comes to infertility issues. Why do you think that is?
Well, I think it's one of the reasons is empowerment. You know, getting access, first of all, getting, you know, the level of education that would, you know, lead you to go to seek care from a qualified or trained practitioner, you know, who would be able to investigate. And also the availability of investigative modalities in our part of the world is also a limiting factor that actually prevents people from getting, you know, adequate care. And, you know, so these are contributory factors. To us having, you know, a problem, and also financial challenges. I think, you know, I've been having problems, you know, sending patients for, you know, investigations, and then they go, you know, a lot of money is being asked, you know, for certain basic tests, which you would require to get done, and they are unable to get to that. So it's actually a challenge for us also clinicians, you know, from that front. But financial challenges also, you know, how much knowledge people have about fertility and how to manage and how to investigate and what to do. And also, of course, you know, even the availability of certain services, you know, with regards to fertility and conception. You know, those are challenges actually that affect our...
Yeah, I also think, most health ministries within, you know, in these parts of the world, they're grappling with basic services. And I think mostly, like I said before, we are grappling with booming fertility rates. So the ones who are infertile are probably the neglected few. Isn't that the reality? Because you're thinking, our total fertility rate in Sierra Leone was 4.7, which means every woman is supposed, can have 4.7 children, closer to 5 children. So you don't really think about those women who are, or those couples, I should be specific, who are suffering with things like that, don't you think? Like when they're thinking about, okay, I need to provide gloves, I need to provide this. No, I'm not going to open an IVF center in Sierra Leone.
Yes, I quite agree with you. I quite agree.
It's a necessity.
It's an issue. And let us not miss this point. The burden of a couple, psychological burden, emotional stress on them for not being able to conceive, especially within our own context and society.
Exactly.
Looking at the way, childbearing and conception is being perceived is a huge challenge that creates enough stress for not just the couple, but even their family members.
Right.
Mind you, marriages are actually families getting together, and then one of the things they are looking forward to is actually, conceiving a child or a baby. And when that does not happen, you know how it is perceived, in our setting.
Thank you so much, Dr. Sesay. Viewers, this has been The Woman's Place. I want to thank Dr. Sesay for coming to The Woman's Place and helping us to discuss the subject of infertility. We've highlighted possible male and female causes and discussed ways in which the conditions can be managed in Sierra Leone. Even though Sierra Leone cannot boast of, for example, laparoscopy that you would see on Google or artificial reproductive services, we are now part of the Mark Foundation More Than a Mother campaign. So we can be compassionate and we can be empathetic towards couples who are going through the struggles of infertility. Now, the World Health Organization actually reports that intimate partner violence and gender-based violence have been shown to have significant association with couples suffering from unwanted childlessness. We all have a role to play, and we can all do better when it comes to infertility issues. Many thanks to the team here at AYV Television. Many thanks to you viewers for inviting us into your homes this evening. Thank you to our callers. Sorry we couldn't take more calls. Remember to check out our Facebook page at The Woman's Place. Until next time, I am Dr. Frances Sesay, wishing you all a good evening and a happy and healthy weekend.
You're watching AYV Television.